Hello, my name is Luke Herbert. I am Director of Pharmacy at KSB Hospital. Today I am going to review some information about COVID-19 vaccines. Thank you, KSB Community Wellness, for putting this program together. And today as I record, it is February 12th. And I mention that because we're speaking about COVID-19 vaccines, and the information availability of the vaccines has been changing on a fairly regular basis. So the Pfizer and the Moderna vaccines are the two vaccines available on the U.S. market at this point in time. Both of those vaccines received FDA emergency use authorization back in December. Both of those vaccines, which are really pretty similar along the lines of safety and efficacy and effectiveness, and both of those vaccines are RNA vaccines, or messenger RNA vaccines. The studies used to gain FDA emergency use authorization enrolled 44,000 and 30,000 patients respectively, so they were very large clinical trials. The efficacy after the second dose of vaccine is around 94 to 95%, meaning that patients who did not receive vaccine, who received placebo, had about a 95% greater chance to get COVID than patients who had been vaccinated. And while a few patients who were vaccinated did get COVID, there were no severe infections reported in vaccinated patients, so those patients didn't wind up in the hospital. The duration of effectiveness is still a bit of an unknown, we'll learn more about that as we go through the year. There's no reason to expect the duration or the duration of effectiveness to be short. It should be at least a year, and hopefully more than a year, 2 or 3 years. But we won't know that until we get through this year and have more information. So what is emergency use authorization? The FDA studies used to approve or gain emergency use authorization for the vaccines were the same type of studies and process as the FDA uses for other vaccines. So an emergency use authorization is an early determination that given the pandemic, we have enough information about the safety and the effectiveness of the vaccines at this time to make the call that the benefits outweigh the risks to use the vaccines now. The studies will continue through 2021, and we will continue to track the safety and the efficacy of the vaccines. The manufacturers will measure antibody levels in vaccinated patients through this year, and will continue to track the incidence of COVID infections in vaccinated people through this year. Providers report adverse events to the FDA. So if we vaccinate somebody and they have a serious side effect or unusual side effect, we'd report that to the FDA immediately. And patients can also report side effects and the severity of their side effects to the FDA via an app that's made available after vaccination. So when somebody's infected with COVID-19 virus, your body or your immune system makes antibodies against the spike proteins and other proteins on the outside of the virus. So this model depicts in red here the spike protein. In the making of those antibodies and identification of the virus are one of the ways that your body fights the infection. When somebody's vaccinated with RNA vaccine, the vaccine basically just makes the spike protein and essentially tricks your body into making antibodies against the spike protein. And then subsequently, if you're infected with the virus or exposed to the virus, you have antibodies in place to identify and immediately attack the virus, hopefully preventing infection. So RNA technology is not completely new. Work has been done with RNA vaccines against SARS, MERS, as well as other things such as influenza and rabies. This research has greatly helped to speed up the development of the vaccines inside of a year last year. And RNA is basically a blueprint for a specific protein. The RNA in the vaccine is an engineered blueprint for the spike protein found on COVID virus. The vaccine delivers the RNA into some of our cells, and our cells make the spike protein. Our immune system creates antibodies that will be ready to identify and attack COVID virus if we are subsequently exposed. Our own cells routinely use and then discard RNA in a very short period of time. And that's what happens to the RNA in the vaccine. The vaccine does not contain any DNA and cannot affect your DNA. You cannot get COVID from RNA vaccines. And there is no live virus in the vaccine.
Thank you.
So the safety profile of the vaccines are quite favorable. There are some common side effects that are largely rated as mild to moderate. And the common side effects are self-limiting, meaning they last typically 1 or 2 days, sometimes up to 3 or 4 days, and they're not known to be dangerous. Allergic reactions can happen in about 1% of vaccinated patients, and more severe anaphylactic type reactions occur at a rate of about 1 in 100,000 vaccinations, which is pretty similar to other vaccines. So the side effects of the vaccines are listed here. This in particular are the percentages of the side effects for the Pfizer vaccine, but the Pfizer and Moderna vaccine side effect profiles are relatively similar. So fever, fatigue, headache, chills, muscle and joint pain are the relatively common side effects. Those occur in a relatively low frequency with the first dose, but are much more common with the second dose. So in up to 50 to 60% of patients may have fatigue or headache that can last a day or two. Pain at the injection site can occur in about 4 out of 5 patients, and sometimes that progresses to a little bit more swelling and redness at the injection site. Again, all these side effects last a couple days, maybe up to 4 days. So a few reasons to consider vaccination. The vaccines do appear to be safe and effective for large clinical trials. And while COVID is often mild and self-limiting, it can be unpredictable and very severe. Post-viral syndromes or prolonged recovery from COVID is a very real thing that we are learning a lot more about at this time. And it often affects young and relatively healthy people. So things like heart failure, fatigue, forgetfulness, brain fog, nerve pain, and headache can all occur for sometimes several months after somebody recovers from COVID, and sometimes just from a mild case of COVID. There are quite a few research centers and medical centers across the country who are starting to develop or have developed programs to treat and study post-COVID syndromes. A couple more reasons to consider vaccination would include to protect your vulnerable neighbors and family members and coworkers, and help our friends who are trying to work at or run a local business. The vaccines can help us accomplish herd immunity and are likely our best path to back to normal. So we can go to sporting events and other large gatherings without worrying about getting or sharing COVID virus. When I speak about herd immunity, I'm basically talking about when we can get to a point where enough people have been vaccinated that people have antibodies against the virus, and so there's less risk of sharing the virus among people that you're around, and at that point virus will continue to or stop circulating so prevalently in our communities. I want to just kind of briefly mention the COVID variants a little bit. The variants are starting to get established in different places in the United States. The variants are known to be more transmissible, meaning if they get established in our community, the rate of infection and sharing an infection will increase. And there's some data to indicate that some of the variants may be more virulent. In other words, they may make people more sick. So vaccination of our population can reduce the spread of the newer variants and keep them from becoming established in our communities. So while we work to get our population vaccinated, it is as important as ever that we really double down on masking, distancing, avoided large crowds and gatherings. So our local health departments are working very hard at this time to get people vaccinated. And it's important to understand that they can only vaccinate as quickly as they have vaccine available. Currently, we're working in phase 1B to vaccinate persons at 65 years of age or older, and also essential workers. So you can sign up for COVID vaccine at your local health department website, and KSB is currently working with Lee and Ogle counties to help vaccinate people in our area. We are working off the Ogle and Lee County lists for vaccination, so we don't have a separate list that we're building on our own. If you go to the KSB website, ksbhospital.com, you'll find a link here to the KSB COVID Hub. And if you click on that link, it will take you to this page, and there's a shortcut here to find your local health department form to sign up for the vaccine. You can sign up family members if they don't have access to the internet, or friends. It's pretty easily, and just takes a couple minutes. And there's a lot of other information on the website about local information about COVID virus and the vaccinations. So I want to thank you for taking a little bit of time to learn about COVID vaccine, and hopefully help you make a decision about vaccination. And again, I want to thank KSB Community Wellness for putting this program together. Thank you.